So we can have women ranging the age range from about 25 to about 50. The age is a specific age group that is at risk of developing this fibroid. And then number 2, we have race and family history. Family history, I'd like to stress on that because certain individuals are said to be predisposed to this fibroid courtesy of their family history. Now, consider a female, an individual whose mother went in for a surgical operation on uterine fibroid, and then the grandmother, and then the great-grandmother. That individual will be at risk of having fibroid. That does not specifically or categorically say that uterine fibroid are transferred genetically. That does not categorically say. But those individuals are at more higher risk of developing or going down with this uterine fibroid. And also race. Statistics has it that the African American women are more exposed, are more predisposed to this fibroid because they have a higher volume of the hormone that actually foster the growth of this fibroid. And also they have a chromosome known as the chromosome 10, which fosters these fibroids. Okay, I'll be talking on the causes of this fibroid. What are the causes of this fibroid? The causes of fibroid are not categorically stated. The exact causes of fibroids are not categorically stated. What do I mean by that? The exact causes are not actually, but okay, we have certain factors whose contribution can never be overemphasized. Factors such as hormonal factors, genetic predisposition, and lifestyle factors. Hormonal factors, just as I mentioned earlier, hormones such as progesterone and estrogen that are often present in females within their childbearing age. These are the hormones that regulate the uterine cycle and other cycles that are present in females. Genetic predisposition. I've mentioned that a female who has a family history of uterine fibroid are more predisposed, are at more risk or at higher risk of developing this uterine fibroid. Other factors include lifestyle factors. People consuming food, proteinous food such as red meat are also predisposed, and people who do not regularly exercise and they don't regularly take fruits and nutritious substances, they just take in any junk, they are more predisposed to having fibroid. Okay, what are the symptoms? What are the symptoms of fibroid? How do you know that an individual, a particular female, is having this fibroid? What signs and symptoms will tell you? Number 1, we have heavy menstrual bleeding. Heavy menstrual bleeding. Number 2, we have pelvic pain and pressure. Then menstrual irregularities. Menstrual irregularities. Today, your period comes in at 28 days. Another time, it's coming in 25 and shorter and just irregular. It does not have specific length and all the rest. So we have other symptoms such as painful sexual intercourse. Painful sexual intercourse. Then we have frequent urination or bladder difficulties and constipation, abdominal enlargement, and all the rest. So, frequent urination or bladder difficulties. Now, consider a fibroid, because the anatomy has it that uterine fibroids, or Okay, the uterus is found between the bladder in front, the urinary bladder, and the rectum behind it. So the size of a particular fibroid, which is big and massive, can actually compress the bladder, reducing the capacity, the normal capacity of this bladder, making an individual to urinate very frequently. Now, if this bladder is supposed to take 1,000 to 1,500 ml on a normal day, this bladder cannot take in urine, cannot store urine temporarily because of this blockage, because of this compression. Because fibroids can also compress the other surrounding organs around it. We have constipation. These same fibroids, some large fibroids, can actually compress the rectum and cause constipation, difficulty in passing bowel movement. Then we have abdominal enlargement or swelling. Yes, abdominal enlargement also. Okay, I actually nursed a patient in the hospital where I have served. I actually nursed a patient, and then I listened to the relative talk. I actually listened to the woman, and I confirmed that this woman has been carrying, her stomach has been large. She has been carrying fibroid for a very long time. I think around 2 to 3 years. This woman has been pregnant with something that is unknown. So when she went to meet healthcare practitioners, and they encouraged her on further action, they examined her pelvis, and then she went in for the operation, and by the grace of God, it was successful, and they cleared her. Imagine an individual, and other people around who are not medical practitioners, they actually think that, okay, this woman is pregnant, but this is more than 9 months. This is more than 1 year now, and then we are not seeing any fruit. Madam, Afa, don't you deliver your child or something? So the woman has been discharged, and I think by now she's enjoying her life.
But what do you think makes them have so much faith that this could be a child even after it has exceeded 9 months and it's counting, but still they want to just carry the thing?
Okay, during that period, actually, when I conversed with the woman, she was actually, all these women that stay in rural areas, she actually had certain symptoms that made her believe that she took in and she's pregnant and she was expecting something. But she was not going for checkups because she had her first 3 children, according to her, at home. She according to her, she's a very strong person. You know, all these women that say all these kind of things. So when things began to escalate, people began to advise her, Madam, okay, please go and try and see a medical practitioner who will help you and give you better advice. And when she went, they examined her, they checked her symptoms, and then they found out something. They gave her better prognosis and diagnosis, and she was booked in for a surgical operation where they operated her via myomectomy, and they removed the fibroid. Okay. Still on the symptoms, we have abdominal swelling, just as I mentioned in the woman's case. And then we have backache and leg pains, infertility and pregnancy complications and other symptoms. This backache and legs. Now, if this fibroid is so big that is disrupting or is compressing or is exerting pressure on surrounding nerve vessels that supply the lower extremities, this fibroid can actually cause pain and backaches. So, among the symptoms, I have mentioned heavy menstrual bleeding, pelvic pain and pressure, menstrual irregularities, painful intercourse, frequent urination or bladder difficulties, constipation, bowel issue, abdominal enlargement or swelling, backache or leg pains, infertility or pregnancy complications, and other symptoms. Now, we're going to delve into the main topic, or the segments that carries our topic. We have the impact. What are the impacts of fibroid, uterine fibroid, on the female reproductive health? Why some women does not show symptoms? They are asymptomatic. Their impact, okay, the impacts, I want to say, varies between individuals. You can have individuals who have these fibroids and then they don't show symptoms, and sometimes in those cases these fibroids are actually small and they're not as big, or they're not as big as having an ability to cause a particular symptom. The impacts include infertility, miscarriage, pregnancy complications, preterm birth, placenta abruption, breech presentation, cesarean section delivery, postpartum hemorrhage, uterine contractility impact, fetal growth restriction, and so on. So having mentioned them, I would like to say one or two things about them. Number one, we have miscarriage. Okay, I mentioned infertility first. Infertility. What is infertility? Infertility is a medical condition, or it is a state in which an individual is having continuous sex, unprotected sex, for 1 full year and is unable to conceive. Is the inability to conceive despite having unprotected sex for 1 full year. How does fibroid affect infertility? Now, anatomy has it that before a woman conceives, there are two very important components, which is the ovum that belongs to the woman, and then the sperm from the man. After sexual intercourse, the two of them, they merge, they fuse, a process known as fertilization, and then we have the zygote, which continues to grow from there. And then on, after multiple series of cell development and differentiation, implantation takes place, where the ovum attaches to one side of the uterine in the endometrial wall. The zygote attaches, it implants, it burrows into the endometrial wall. Now, if a particular fibroid, specifically the submucosal fibroid, why? Because it is found inside and beneath the submucosal layer of the uterus. If we have a case whereby a submucosal fibroid is interrupting, or a zygote is trying to implant into the uterus, and then is being obstructed continually by fibroids at specific positions, because obviously we can have multiple fibroids which are also large, as I've seen in many cases. So this can cause infertility. You're having sex continually, and then there's fertilization, and then there's an inability to be implanted. It does not implant. It is not able to burrow into the uterus. And then we have miscarriage. What is miscarriage? Miscarriage is the loss of a pregnancy before 20 weeks of gestation. Okay, fibroids, submucosal fibroids, can actually affect the blood supply to the uterus even after a successful implantation. Before 20 weeks of gestation, of pregnancy, a particular fibroid which has an implantation just close to it, that fibroid can obstruct that uterus and prevent it from further developing, which results to miscarriage. Then we have pregnancy complications such as preterm labor, preterm birth, placenta abruption, and breech presentation. Preterm labor. Preterm labor is often characterized by the sensation of conception, characterized term before full weeks of gestation, which is 40 weeks. And then we have preterm birth. When we have preterm labor, sometimes in very serious and complicated cases, the health practitioners involved might actually advise to give birth to the baby, to actually bring this baby out. Maybe if the fetal supply, the oxygen supply, the artery and the veins, the placenta has been detached or has been severed, there's nothing you can do to help this child inside the womb. What is the best option there is to bring this baby out of the womb. And then you have breech presentation. Now, after implantation or during the process of gestation, there's a particular period before birth, before full term, that the baby repositions, the fetus repositions himself to face the birth canal, so that having the head facing the cesarean section delivery. There are many indications for cesarean section delivery, but fibroid specifically can cause or can be an indication for cesarean section delivery, where you have a cesarean section where they cut, in simple terms, they take the woman in and they cut her abdomen and they bring out the child. She's not actually delivering the baby through the normal process. A particular fibroid can block the birth canal. These fibroids, they don't have any specific location where they actually grow. It can be found on the wall just around that birth canal, just at the cervix, and prevent the baby from actually coming out. This can be a very good indication for cesarean section delivery. I've mentioned breech presentation. Breech presentation is a situation where the baby is not positioned correctly because of this particular fibroid. Fibroid can cause breech presentation, where the baby is not free enough because some part of the womb has been occupied by something else, by this fibroid. And then we have postpartum hemorrhage after pregnancy, bleeding, uterine contractility impact, fetal growth restriction, and also enlarged abdomen, a swollen and enlarged abdomen. Fetal growth restriction. If a very good portion of the uterus had been occupied by this fibroid, how would a baby that's supposed to take up the whole volume of the uterus, how would the baby thrive in that place? So this can result in growth restrictions, which can actually, if not treated or if proper medical interventions are not taken, it can actually lead to deformity in this child. It does not give the child enough room to breathe, enough room to grow and develop all the necessary organs for survival. So how are fibroids diagnosed? How do you know that this thing is fibroid? Okay, we have medical history, physical examination, tissue biopsy, and imaging methods. We have medical history, physical examinations, tissue biopsy, and imaging methods. Medical history. When you go to see a health practitioner and you present your symptoms, they will actually take the history. This gives them a baseline data on which diagnosis to prefer, on what this particular patient, on the necessary measures to be taken to address your issue. Then followed by a physical examination, where you as a female, they assess your abdomen via a process known as palpation. They assess the abdomen for irregularities, if they can actually feel any abnormality in the integrity and the normal shape of the uterus. And then followed by tissue biopsy, where a small section of the uterus is swabbed and taken to the lab for further investigation of these symptoms. And then we have imaging studies. These are obviously the most, or they have been found to be the most reliable. We have ultrasound, we have MRI, which is the magnetic resonance imaging, we have the hysteroscopy. The first two of them I've mentioned among the imaging studies are non-invasive. What do I mean? That they don't have to go inside the body to actually check and see and look for this fibroid. Check if the uterus is normal, if the womb, in simple terms, is normal. Ultrasound, where they use the ultrasound scan to scan the abdomen and the pelvic region for the proper anatomy, if this uterus is proper. And then we have MRI, magnetic resonance image. If the data gotten from the ultrasound is not clear enough to provide solution or to diagnose this patient, the patient can be further sent a torchlight and a camera. It is a narrow cylindrical tube that is inserted into the vagina down to the uterus to visualize, to give them a better picture of what the uteri looks like. If they can find certain distortions and abnormalities or fibroid presentations. Treatment method. What are the treatment method? An individual who has been diagnosed with fibroid, is it the end of the day for that person? Do you just tell the person to go home after diagnosing the person with this kind of ailment that is actually scary to some people, because many of them think it's actually cancerous, because so many people have this belief that fibroid is actually cancerous. What do you do as a health care practitioner? In the treatment options, we have the conservative management approach, and then we have the surgical interventions. Medications are the first line of action in fibroid cases, depending on the severity, depending on how severe the symptoms are, and depending on the size of the fibroid. For certain individuals who have little symptoms, they can actually be given hormonal medications and birth control pills. This will help them shrink the fibroid. So long as they continue taking this medication, it will help them for this particular fibroid. But this does not work in all cases, because fibroid, as I mentioned, it varies in size and in numbers. And then we have lifestyle. We encourage regular exercise, regular exercise, good diet, healthy diet, maintaining a healthy weight, and taking in rich fruits and vegetables, whole grains, etc. Then for the surgical intervention, which is the one we all know, we have myomectomy, hysterectomy, uterine artery embolization, and radiofrequency ablation. Don't be so scared. I'll mention this. I'll explain further. Myomectomy, hysterectomy, uterine artery embolization, and radiofrequency ablation. for the myomectomy, this is a surgical procedure. It's an invasive procedure where the fibroids in the uterus, they're actually removed, they are severed, they are detached from the uterus while trying to preserve the uterus. The myomectomy can come in forms like laparoscopy. We have hysteroscopy, which is the other one. But this one now is not just to view the uterus, it's actually to detach the fibroid from its place of implantation. And open surgery, where they open the abdomen and the pelvic region to bring out the uterus and work on that particular fibroid. Note, the surgical intervention depends on the type of fibroid, depends on the size of the fibroid, and possibly the number of the fibroid and the location where the fibroid is. Hysterectomy, this in very severe cases, very severe cases, individuals having a very severe symptom and signs, the womb is actually removed, detached, to prevent this individual. The ovaries are detached, which are the major sources of the production of estrogen. If there's no womb, there's no estrogen and progesterone. So this is a procedure whereby it's a minimal invasive procedure involving the injection of small particles into the uterine artery to block the blood supply to the fibroid. Now, for every living tissue, every single cell and tissue in the body needs oxygen supply, needs nutrients. And all these nutrients, oxygen supply, they come from the artery. So if you actually do anything to occlude and block the flow, the source of this supply of oxygen and nutrients, you have actually killed that tissue. That tissue will die on its own if you do anything to block the oxygen and the nutrient supply. So this uterine artery embolization is a procedure that is used to block the supply to the artery. It can also be known as the uterine fibroid embolization. Then we have radiofrequency ablation, which is a procedure in which heat is used for the treatment. Okay, public health intervention, I'll just mention because of time. We have raising awareness in the communities because there are certain people who do not know about this fibroid, don't have better understanding of this uterine fibroid, and they don't even know that they themselves have this fibroid. They don't know. Promoting early detection. Okay, you go to a community and you teach them that if you have such and such symptoms, please run and rush to see a medical and a health practitioner. Providing access to information. As a healthcare practitioner, the patient comes to you. It's your duty to educate that client, that patient, on what to do. Equitable access to care. Okay, this is for the government. The government are expected to provide equitable access to care. Make care, the surgical interventions, which are actually very expensive for people staying in the rural areas and not able to afford these treatment options. The government is expected to come in and stand up for them and make the care accessible and affordable and even available to them in their different locations. And research funding. This is also for the government and the non-conglomerate to come in and stand up for the people and women of this age. So lastly, about the myths I said earlier. So along the teaching, I believe I've mentioned a few things. I've touched on these myths. But for the little ones I mentioned nothing about, I actually read them out and then touch them a little bit. Number one, they said fibroids are cancerous growth of the uterus. Is it true or false? Not really. Some fibroids, but in very severe cases, the prevalence is actually very low. That fibroids are cancerous. Some fibroids are cancerous, very little. But the vast majority of fibroids that we have are non-cancerous growth of the uterus. That hysterectomy um, is the only effective treatment for uterine. And then we have fibroids only affect women in their 30s and 40s. That's not true. Fibroid affects both women or young girls. So far they have this hormonal interplay, but it is more common in women in their childbearing age. And then the last one we have, once fibroids are removed, they can't come back. Is it really true? No. Thank you.
All right, thank you very much, Nurse Wariboko Gostime. It was mind-blowing session, and I think I really did learn a lot, and I'm pretty sure that everyone else did so. Right about now, we will be going on a very short break, and when we come back, we'll go right into the next segment, so stay with us. If you're just joining us, this is Atn Health Forum, and right about now we'll be going to the second segment on Doctor and Me. In this segment, we will be listing a couple of symptoms where Dr. Wariboko is going to tell us what could be the cause of these symptoms. Now, Nurse Godwin, if an individual is experiencing pain in the back, pelvis, or side part of the body, pain during sexual intercourse, abnormal, wrong with the said individual?
Yes, as I've explained earlier, these are actually the exact symptoms I listed. But first of all, okay, you said what could be wrong, right? The person might have this uterine fibroid. But first of all, when you have these symptoms, you have irregular menstruation, all these symptoms she has listed, you go see a healthcare practitioner. You don't just begin to try this one, try that one, as many people do. Because so many people, they're actually open to many options that people will present to them. The most important thing for you to do as an individual, a woman sitting and listening to me in your room, wherever you are, is to seek medical attention. Go to a doctor and get better knowledge, because they will examine you. They will examine you and then diagnose you properly for whatever the sickness or the.
Okay, Nurse Gostime, do you think that the uterine symptoms and the symptoms of someone that has an ovarian cyst could be the same thing? Or someone that has a cyst and someone that has fibroid, do you think the symptoms could maybe come off as the same thing?
Yes, actually, yes. The symptoms are actually similar. Yes, for an ovarian cyst and then someone that has uterine fibroid, despite the fact that an ovarian cyst they are the same thing. Menstrual cycle and uterine cycle. What is different is ovulation cycle. We have two cycles basically. We have the uterine cycle, the shading of the uterus every month, and then we have the ovulation cycle. But the menstrual cycle and the uterine cycle, they mean the same thing. Yes, they are the same.
All right. Okay, so this next question is coming from Victory from River State. Victory says, I believe we're all human. How does race cause our hormones to differ? Could it be the food or weather?
Well, that place where I mentioned race, that race is a possible cause that can predispose an individual, because statistics has it that African American women are more disposed because of their specific genetic makeup. Now, tell me, an individual, okay, two individuals, one is black and one is white. One is, do you know that there are actually different genes that genetic interplay that actually differentiate this individual? It's not, you don't just say that everybody, that we are all humans. No. When you look at it genetically, we have distinct genetic makeup. And there's a particular chromosome known as the chromosome 10, which actually predisposes an individual. It fosters in the growth and development of uterine fibroid. And statistics has it that African American women has a higher volume of estrogen, which is a very, very big contributor to the development of uterine fibroid.
All right, this other question comes from Omasurichi from Lagos State. She says, you said unprotected sex for a year is how one determines infertility. Does the individual have to wait a year to term its infertility?
Okay. Well, there are quite a lot of definitions, but the simplest I just gave because of time and all the rest. It is medically approving before we can actually say this is infertility. We have to give them time. Continue on your regular unprotected sexual activity for people looking for conception. Continue with this and let us watch. So yes.
All right.
Infertility is an inability to deliver, just as I defined earlier, despite having regular unprotected sex for 1 year.
Okay, and this last question is coming from S.